Well, good afternoon, everyone. Welcome to another COVID-19 webinar organized by Global Branches. Today, we'll be talking about how to help immunocompromised patients during the pandemic. And for that purpose, today we have the pleasure and honor of receiving Dr. Deng, Dr. Gary Deng. He's the medical director of the Bendheim Integrative Medicine Center at Memorial Sloan Kettering Cancer Center, and also professor of clinical medicine at Weill Cornell Medical College of Cornell University in New York. His professional expertise is in the use of an integrative medicine approach to help patients and family members throughout continuum of cancer prevention, treatment, and survivorship. Dr. Deng has taken the leadership role in the emerging and evolving field of integrative oncology, which uses non-drug therapies to improve patients' physical and mental resilience, that also supports patients during cancer treatment, and finally also promotes long-term health and well-being after cancer treatment. Dr. Deng is active in conducting research and developing innovations in the field. He is the principal investigator of research projects on acupuncture, yoga, and botanical agents. Today, Dr. Deng will be talking about the pathophysiology of COVID-19 and its implications to traditional Chinese medicine, the current evidence of traditional Chinese medicine herbs' potential in managing immunocompromised patients, and finally, how to approach them safely, though, how to approach those patients safely during this particular time of pandemic of COVID-19. I would like to remember our participants that this webinar, well, this presentation will last about 1 hour, and then there will be 30 additional minutes that will be used for questioning, either by the Q&A section at the bottom of your Zoom screen, or by raising your hand if you wish to speak instead of writing. And without further ado, Gary Deng, be very welcome. Thank you for accepting this invitation of ours and this challenge. And I'll let you then start your presentation. Thank you.
Okay, good afternoon. Thank you. I'm really I feel the pleasure of sharing this platform with you and share my experience doing clinical work and research work in this field. So I'm from Sloan Kettering Cancer Center, a large academic cancer center in New York City in the United States. And today's talk would be on how we treat cancer patients. Many of them are immunosuppressed, and how our treatment to them is relevant to in the backdrop of the current pandemic of COVID-19. May I have the title slide, please?
Sure. I don't know if, Ricardo, can you share it? Please just wait.
Just a moment, please.
Sure, thanks.
Actually, I think maybe I can share my screen. Do you see my screen?
Right now we can only see you, to be specific.
Okay.
So do you want me to share it, Doctor, or will you share it?
I requested to share my screen. Did you see that?
Just a moment.
Yeah, I see it. Great, perfect, it works.
Yeah.
Excellent. Okay, so so this is great. We always have some technical issues. Anyway, so you can all see this, right?
Yes.
Yeah, so we're going to talk about COVID-19, how to help immunocompromised patients during the pandemic now. And we're going to, first of all, I'm going to give a summary. We're going to talk about pathophysiology and how it's relevant to the traditional Chinese medicine paradigm and the current evidence of TCM herbs and potentials in managing immunocompromised patients and how to approach and treat cancer patients safely during these pandemics. So as you know, New York City was one of the epicenter of COVID-19. This was, some of you guys have probably been here before, the Times Square in the city. Normally it was a very crowded place, but in April, it looks like this. And fortunately, we are making a lot of progress. So if you look at the COVID-19 in New York City, the cases, it peaked around April and has been coming down to almost very little. And if you look at the hospitalization, it goes up for about a month or so, it slowly comes down here. And most importantly, if you look at the mortality rate, the death rate, it went up. And today is the first day there's no COVID-19 related deaths reported in New York City. So this whole thing tells us several points. One is, it is an infectious disease. So if we exercise public health measures like social distancing, hand washing, face masks, and so on, it is controllable. Even in a large metropolitan city with close to 20 million people and with a pre-existing infection rate very high. I mean, I think in March, there are like 5 or maybe even 10% of people in New York City has been exposed to it. And it is still a controllable disease. So that's very encouraging. And so sometimes when we talk about treating COVID patient, we'll say, is it still relevant, right? It's gone, it's over, is it still relevant? I think it's still relevant. Number one, in New York City, maybe it's subsided, but in other places in New York, in the United States, they're actually going up, like California, Texas. Because New York City was one of the first cities to get hit, so other places they're going up. So there are still a lot of COVID patients in other cities, and more broadly in other part of the country, other part of the world, especially like Latin America and so on. So we see there are still a lot of cases. So what we talk about is still relevant in this backdrop. And this is a prediction actually made in early April by Morgan Stanley about the course of the COVID-19 cases. I was, at that time, I was looking at it, and then when we look back, they were surprisingly accurate. If you look at, this is made like April the 1st or April the 5th. And they said it's gonna go up like this. It'll peak somewhere April and May, and this is the whole United States. If you look at the East Coast, New York, it goes exactly like this curve. And it subsided around now, June, it's very low. So they expect there's a little peak because here is when we say, okay, we can open up again. Social distancing is, people can go back to work and go to the restaurant and so on. Then people start to slack off a little bit. So we expect to see a little peak after that. And then hopefully we got it controlled because of massive amount of testing. Everyone got tested, and both for the virus, also for the antibodies, and then we subset. But because they're so accurate here, I tend to believe they're probably accurate here again. So coming this winter, we expect another wave, a smaller wave, but it may come back again. So we still have to be prepared, right? Even now, I think in Europe it also have subsided, but we still have to be prepared of what's going on next. In addition, a lot of these patients, even though they finished with their COVID course, a lot of them still have residual problems, symptoms and residual problems. I had a patient, actually I have an employee, a colleague, young women, 30-year-old, diagnosed in early March. And they're still symptomatic. They said they're like, one is like 75% recovered. The other one was like quite sick still. So there's some long-term consequences. Either the virus is still there, or your body's immune system keep reacting to the virus and still damaging your body. So a lot of these patients have chronic fatigue, body aches, and so on. Like several other virus infections, like EBV virus, or some other infection like Lyme disease, and people can have long-term consequences. So as a medical profession in the medical field, we still have a lot to do that we can do to help these, we call them COVID survivors, and the upcoming wave this fall and this winter. So it's still time, but in the last 2 months or so, there's so much research come out, so we learn a lot, and still time we can take what we learned in those months and design and develop some strategies for the next year or so, until maybe a vaccine come around. But even though when vaccine come around, it takes a while to vaccinate a majority of the population. So what we're talking about is still relevant. Well, when we talk about immunocompromised patients, so let's look at the general population. This is, if you count 100 patients, right? This is 10 by 10 squares, 100 COVID patients. The majority of them are actually mild cases, like all these blue ones. Some has very, very, very little symptoms, and some have asymptomatic. I have several cancer patients. They're young and they are actually asymptomatic. They didn't know they had it, and only through incidental testing we found they had COVID back early May, and then by now they're antibody positive. But throughout the whole course, this particular patient, again, a young man, had no symptoms at all, and his mother lives in the same household, had no symptom at all. So on the other hand, there are a lot of people who are very sick and hypoxic, even goes to the ICU for critical illness, on a ventilator, or have multi-organ failure. So the question is, why is it the same virus infect 100 people, and we have such a diverse response in terms of the disease and the course of the disease, right? So at this point, we are only treating people with severe symptoms, mainly admission, monitor for oxygen, and if they need a ventilator, put on ventilator, but the majority are going home. So how do we prevent these people from moving into the severe case and then reduce mortality? That's where I think there are a lot of things we can do, and especially with traditional Chinese medicine, I think there's a lot we can do, either to help preventing patients getting infected, and maybe reducing the risk of mild case patients going into severe case or critical case. So why am I saying that? I'll show you some data, and it's based on our understanding of how COVID caused disease. So how do we treat the severe case? We still have no specific symptoms. But I have to say, I think in the next few months, some specific therapy may come out. And I'll talk about therapy in a little while. And if we can prevent patients from mild symptoms from progressing to severe case, that would be very helpful. So what made patients have mild disease? Because the ability to fight this virus is already in our body, at least in some of us. In some other patients, in some of us, it may not be there or may not be strong enough. But in the majority of them, we already have this ability. So now the question is, how do we enhance this ability and harness that? So this is how the virus come in. And when we look at the roadmap, we can have different interception points. So the virus, they have RNA inside, they have a fat bubble wrap around them. On the top, they have this spike protein. The spike protein binds to a receptor called ACE2 on the cell surface. And it's like a key going to a lock. If they match, they turn the key, and then the virus get into the cells. The DNA, the RNA start to replicate and produce more virus, and they release thousands, if not billions, after they replicate inside the cells. In this process, several other things happen. The cells may die, and we release the antigen, and there are also immune cells. This green one is the immune cells, like a macrophage. That's our first line of defense. And This is called the so-called innate immunity, which means our baseline immunity, the things what we already have. And where does that come from? I think it's pretty relevant in traditional Chinese medicine because in traditional Chinese medicine, this wei qi, the force to defense, is very much correlate to this innate immunity, right? There are people who just have a very weak wei qi and they get infected all the time. There are people who have very strong one and they don't get infected easily. And that's usually when we talk about the innate immunity, that's what we usually talk about. And then once they got activated, it's the first line of defense. Sometimes they can just recognize certain part of the virus and repel them. And they also can mobilize the immune system by secreting all these cytokines and recruit other monocytes, macrophage, T cells, and B cells later in there. So this is where it happens. So people with a strong, robust, good immune system, they usually can go to this path. They have a strong reaction to the virus, they eliminate them, and all this antibody comes in, and they got a mild course or no symptoms. However, on the other hand, there are patients who have too much, initially too little immune system, so the virus start to multiply a lot, and then they got a too much immune reaction, like the so-called cytokine storm. The immune cells make so many cytokines that you create tissue damage, not only to the infected cells, but also to normal cells in the area. And then you got a capillary leak, the fluid leaks into the lung, the alveolar, people have problem with breathing, you damage the blood vessels, so you have a lot of tiny blood clots. And then people go into multi-organ failure, because if you do an autopsy, you look at their capillaries of these patients who succumb to COVID-19, a lot of these capillaries are clogged up. So there's no blood supply. Even if you put them on a ventilator, because there's no blood going to the alveolar, the lung to carry the oxygen away, it doesn't work. That's why there's a ventilator doesn't work very well. The mortality rate on people on ventilators is about 30%. 30% people or 50% on ventilator didn't make it. So you can see these are several entry points we can intervene, both through Western medicine or through traditional Chinese medicine. One is the viral entry. So are there something that interfere their binding to the cells, or are there something that interfere with them being taken up by the cells or replicate in the cells? And then propagation, things they replicated RNA, they repackaged, they got released. And then the immune reaction. So the immune reaction, what we want is actually people who have the robust immune system at the beginning or before infection or during the early phase of infection, but we don't want them to have too much immune reaction at the end or towards the later part of the course of the disease. Because that's actually when your reaction, our reaction to the virus, immune reaction to the virus actually hurt us. And then you got cytokine storm, multi-organ failure, ARDS, which is a respiratory failure, myocarditis, DIC, all these things. These people usually die from one of these. So what can we, why are people different? So when we understand how the virus function, how the disease come about, we can kind of speculate why everyone's different. So the first one is some people may already have a cross immunity from previous infection from other coronavirus, right? Because this is novel coronavirus, a new coronavirus. It actually shares the majority of the protein and antigens with all the old coronaviruses. Only a few proteins, especially the spike protein, is active, is different. So some people who had previous infection may already have a cross immunity. So here, what we try to do is to make sure this cross immunity stays there and go up, right? We know, for example, when you have, let's say, an infection with some other virus, and if you have it in immunity, usually it lasts for a few years, but then it starts to die down. And for people who are elderly or who are weak, who have other disease, the previous immunity is lost sooner. And then another thing is the viral dose during initial exposure. So for people who got maybe only a few virus, the immune system is enough to clear them, so they don't have serious disease. But if people get infected with a lot of virus, billions or so, that can cause a lot of problem because the immune system cannot catch up. The immune system will be playing catch up and cannot catch up, and then they develop a fulminant course. This is relevant for healthcare professionals because initially a lot of healthcare professionals were infected by COVID-19 because at that time they didn't know there is this pandemic, there is this spread in the public. There's lots of public at that time, they carry virus, they spread virus, but people, the society didn't know. These are silent spreaders. And secondly, at that time, people were not wearing all the PPEs, personal protective equipment, like mask, face shield, gloves, and so on. So a lot of healthcare workers were infected then because, for example, if you do an eye exam, you're face to face to a patient who is breathing or coughing, and then you got a lot of virus into your system. So this is relevant in currently because when we go back to work, when we treat patients who are either non-COVID patients or diagnosed COVID patients or suspected COVID patients, we have to make sure we do the adequate PPE so we minimize exposure. Same thing, some of us could be a silent carrier. Like as I said, there are lots of patients who test positive, but they never know they got infected. So if we are one of them and we treat a patient, we don't protect, we don't erect a barrier between us and the patients, we'll have a problem with infecting our patients. And then there is something called polymorphism in ACE2. This is a receptor, it's the lock on the cells, the COVID virus goes in. And we don't have the same. If you look at the gene of this, we have different genes. So some genes may encode the ACE2 protein in such a way that it binds to the virus more stronger and they got more infected. So this is more about genetics and we cannot do much about it. And now it's relevant in that there was a paper just come out yesterday or this week, right? You probably hear in the news, they said people with type A blood are more likely to get infected. People with type O are less likely to get infected. So these things generate a lot of news, but I have to say they're not accurate. I wouldn't recommend getting information from news report because the journalists, they are not professionals, so they may not give us the most accurate interpretation of the data. So I actually went to look at the data myself and the original data, and I found it doesn't support their conclusion. Why? Because when I look at the data, it actually says the odd ratio if you're type A is 1.5, and the odd ratio for type O is 0.5. That's a very small odd ratio. It's like you got 3 patients versus 2 patients. If you're type A, there are like 3 of them. If you're non-type A, there's 2 of them. So it's not a big difference. And you cannot act on this information and develop policies, public health policies. So when we interpret the data, we have to keep that in mind. And again, the RNA HLA polymorphism in antigen presentation is another thing. In our institution, we did some research. We found when we actually have sequenced the genome of people with HLA, and then we see which one of this HLA actually binds to the COVID-19 antigens better. So when it binds it better, it presents it better, and you get a more robust immune system. So again, this is a genetic predisposition. There's nothing we can do about this polymorphism, but it's kind of can explain why some people have very good immune reaction to the virus, some don't. And on the other hand, this whole antigen presentation process is actually influenced by many herbs. I can go into the details in a little while. Some of the herbs can really enhance this antigen presentation process. And then there's another one, which is the reduction of TCR repertoire complexity with aging. Why is this disease affect elderly patients so much more? Because we know the T-cell receptor repertoire in our body, when we are young, is very complex, which means if you see a new antigen, a new virus, chances are you actually already have something that recognize that, some immune molecule that recognize that and activate your T cells, and you got a immune reaction. It's like a rainbow, right? You have 7 colors. But as we age, the repertoire gets smaller and smaller because some T cells died. And so our rainbow is, instead of 7 colors, it got only 1 or 2 colors. And so our chance of recognizing the virus is smaller. And we may get more infected, we may get a weaker immune reaction to it, we may get sicker. So why is this relevant? Because in TCM, in traditional Chinese medicine, a lot of the 养生之道 Tao of nurturing life, it's about how to deter aging, how to treat our body gently without abusing it, and slow down the wear and tear on our body. And this is basically a wear and tear, right? As we age, we have more wears and tears. So a lot of the TCM philosophy in how to take care of preventive care or take care of our health applies here. So right now, people are exploring all kinds of options. These are, when I check it in April, there are like 200 trials. So right now, there are 1,000 clinical trials studying COVID. Some of them didn't work out much, like this hydroxychloroquine. You probably hear the controversy in the news. Well, it may be effective, it may not, but at least it's not a blockbuster. Otherwise, they will have seen the results. And remdesivir, same thing. The study came out. And so this is also important in that why we need to do rigorous research, because these drugs, initially, they just say, oh, I treated 3 patients, they all did better, and none of them got into the ICU. So this drug is working. But we know if you just treat 100 patients randomly, you're going to have 80 patients not going to ICU or not admitted anyway. So those reports doesn't show this drug actually works. So they did actually randomized controlled trial. What they found is it didn't help much, right? It shortened the hospital stay by 3 days, but didn't really reduce mortality. So did they help? Yes, a little bit, but is it a blockbuster drug? No. So same with a lot of all the other drugs, they interfere with the virus binding. This protease inhibitor interfere with how virus got into the cells. And then you got these anti-inflammatory antibodies, anti-IL-6 receptor. So these are used to prevent cytokine storm, to reduce the risk of people getting very sick, right? Going to the ICU and so on. So the study on this also come out on these. Again, they show some effects, but not great effects. And I think the most promising therapy at this point so far is this convalescence plasma, which means people who had the virus, in fact, COVID, they donate their plasma and give it to patients who are acutely ill, especially during serious illness. It appears this actually works quite well. Again, we're waiting for randomized controlled trial data to come out. And this one is also an engineered antiviral antibody. Several companies doing that, the antiviral antibody cocktails, and they're doing clinical trials. So you can see our treatment so far is still limited. We don't have a good treatment, and that leaves a lot of room for us to explore other treatments, and especially traditional Chinese medicine, right? So this is a New York Post report back in March, that demand for Chinese herbs and acupuncture spiked during COVID-19 outbreak because there was no other good treatment for that. And some of these herbs has been used to treat other viral illness and found to appears to be helpful. So people just reappropriate them for COVID-19. So out of these, there are lots of research on traditional Chinese medicine application in COVID-19, but most of them are actually in the laboratory setting. The clinical trials are ongoing. A lot of them are initiated in China, but unfortunately, there are virtually no cases there. So a lot of trials just stopped because they didn't find enough patients to enroll in this study to get a firm conclusion. That's unfortunate. But in other hotspot in the U.S., some other states, they lots of patients. I think that's when we can actually probably do more research. But if you look at the specific during the pandemic, during the outbreak in China, they developed national guidelines. Of course, it keeps updated. The latest was version 7, and these are the common herbal formulations used for mainly these people who are like mild disease. They just monitor them, or they have symptoms but they're not severe enough. They just treat them. And then for severe and critical cases, most of the treatments in TCM treatment is mainly very individualized depending on the pattern diagnosis. There is an IV formulation derived from herbs that was used for critically ill patients. This is mainly to reduce the cytokine storm and inflammation factors in the blood. And then for a recovery case, now we have a lot of these. It also depends on the pattern diagnosis. And the specific herbs also, there are also acupuncture, of course, right? The Federation for Acupuncture Microspasm Society produced guidelines to use for acupuncture. Most of them came from previous experience, and again, it's very difficult to do rigorous randomized control trial in the pandemic setting because people don't want to be randomized to a no treatment or a placebo group. And if you look at the clinical studies and clinical use, here are the common herbs, and we are all very familiar with astragalus and ganzao, licorice, and like honeysuckle flowers, and so on, right? So what exactly do they do in COVID, and especially for people who don't have a robust immune system? Do they help the immune system? So when we say help the immune system, we mean not only boost them, but also sometimes to tame them, so they don't have a too much immune reaction, right? That's the problem with some of the patients. So how do you find that middle point? So there are a lot of clinical or laboratory studies showing these are the herbs that can be quite helpful. The herbacetin from rhodiola, hongjingtian, and several other quercetin, and also from Banlangen, they can inhibit this protease, which the virus need to go into the cells and replicate. And same thing with from ginger and turmeric, there's another substance that inhibit another protease involved in how the virus enter the cells and replicate inside the cells. And Scutellera balinus huangqin, and has the ability to inhibit this helicase. This is the enzyme that the viral RNA use to unwind and start to replicate. And in licorice, ganzao, they have something to inhibit absorption and penetration. And ma huang, ephedra, can dilate the bronchus. So if you look at the Chinese medicine formulation used in China, they have several of these. So it kind of makes sense, at least from a mechanistic standpoint. Some will inhibit the binding of virus, unpacking of the virus, replication of virus, and some will dilate the bronchus, so oxygen exchange is better. And then there are also things that help the immune system, right? And here's another one that actually inhibited S protein expression. So even though one virus is infected one cells, they don't spread too many viruses. And this is a very interesting herb that's commonly used in Da Huang, which is also used in TCM formulation for COVID-19. It interferes with the S protein and ACE2 interaction. So it's almost like you put a chewing gum into the lock, so the virus key cannot go into the body, the cells lock and start to gain entry. And here, from honeysuckle flower tea, lianqiao, and so on, they also have something to inhibit this iron enzyme that's involved in virus release. And saponins interfere with viral attachment. So you can see a lot of these herbs actually do have active ingredients, at least in the laboratory setting, will interfere how the virus causes disease, especially in the entry, multiplication, release, and so on. And then you got all these immune modulation herbs. So they can either facilitate antigen presentation, which means when the virus goes into the cells, the immune cells, usually dendritic cells, pick up the antigen and tell the immune system, this is an enemy antigen, we need to mobilize, we need to attack this virus. And then a lot of herbs has been shown to improve innate immunity, mainly macrophages, and some herbs have been shown to improve antibody-mediated cytotoxicity, which is also relevant in antiviral reactions. So what are these immune modulative herbs? So here are some of the common ones. Most of them came from mushrooms, right? A different kind of mushroom, agaricus mushroom, cordyceps, 冬虫夏草is, in a way, is a kind of a mushroom that grows in the caterpillar of an insect. Coriolis mushroom, Ganoderma lingzhi, Coriola yunzhi, and Lentinula, which is xianggu, 多糖, xianggu. And then there are other herbs that are, astragalus is not a mushroom, but it does have something we know to stimulate the immune system. And curcumin and echinacea, they are actually more like anti-inflammatory, right? They check the immune system so they don't get too much, get too strong. So I'll use a few examples, show some data on a few examples. One is astragalus, right? We know a lot of this active ingredient. We even know the chemical structures. And there was a study done for immune-compromised patients in non-small cell lung cancer patients who are getting chemotherapy, right? So these patients are immune suppressed, and when they give astragalus-based Chinese herb, they found in general, they do better than people who are on chemo only. This is a meta-analysis studying like 334 clinical trials, like 3,000 patients. And another one, this is also, they look at tumor response, right? It looks like when you add this, the chemo appears to work better. So the line, if they're around 1, if the risk ratio is around 1, that means there's no difference. But in most cases, it favors the adding the herbs to the chemo. So it shows they do help these immune-compromised patients. And usually the dose used is like 500 milligram of extract. In the United States, we don't use the raw herb, at least in the hospital setting, but we do recommend them to get it. So this one we sometimes use in people who are immune suppressed and at risk for COVID. We recommend them to take that, but we ask them to stop if they start to have symptoms and diagnosed with COVID. They should stop 5 days and further, because at least in theory, after 5 days, it's really the overactive immune system that's hurting the patients. And they should also not be used in people who needs to be immune suppressed, like transplant patients, right, or autoimmune patients. And Coriolis mushroom is another one. It contains a lot of these polysaccharide, beta-glucan, beta-1,3, beta-1,6, 1,3,1,6 glucans. So these things, they bind to the dendritic cells on the toll-like receptor, pattern recognizing receptors. These are the innate immunity, and they got activated, and they go around and tell the other immune cells, here's an invasion, here's an infection, we need to mobilize, right? So there are also a lot of clinical trial done on this particular agent, and these are randomized control study, meta-analysis of several evaluated. When they pull all the data, you can see all these data is on the right side of the vertical line, which means they favor adding this yunzhi or Coriolis mushroom extract. And overall, there's a 9% reduction of 5-year mortality. So in cancer, we feel comfortable using this in treating cancer patients. The data is strongest in these cancers. This is relevant because we also, this is one of the things we also recommend to our patients who are at risk for COVID, but we ask them to stop. If they indeed get COVID, we ask them to stop a week, 5 days later. And usually the dose is, these are extract. These are not the raw mushroom, right? It's 1 to 2 grams twice a day, and generally safe. One of the things when we treat cancer patients with herbs and natural product supplements, their oncologists are very concerned about interaction. Like, is your herb a detox herb that detox the chemo away, so reduce the effect of chemo? I usually say, well, this one we know for sure because based on chemical structure and previous studies, it's not going to be a concern. So we have to address this concern of interacting with other drugs. And once we do that, the Western medical doctors feel much more comfortable for us to use it. So acupuncture, there are also a lot of studies showing acupuncture can help people with COVID and especially in people going through sepsis. These are very severe cases. So this paper is published on Nature Medicine. And it shows that this natural product herbal research and acupuncture research can be very rigorous and can be published on high impact journal. So this one shows acupuncture can stimulate dopamine mediated through the vagal nerves and modulate the immune system. It's not just increase the immune system, but modulate it so you can reduce sepsis. This is actually done in mice because a lot of people initially in the United States, the Western doctors say, well, acupuncture, are you sure it's a real effect? Could it be a placebo effect? And we usually show them this animal study data, which would take the placebo effect away. So here they got mice in a septic setting. If they got sham acupuncture, their TNF, which is the inflammation marker, goes way high and come down. Same with all the other, like IL-6. If they got true acupuncture, electroacupuncture, they got lower. And they only use one point, which is ST36, Zhusanli. So this is great because in COVID patients, this is what we want, especially in the late stage, right? In the late stage when they are getting a cytokine storm or they're going from a mild case to severe case, if we can stop the cytokine going up too much, we may help them. And they did all the very sophisticated cell stain. They dissect out the neurological pathway, which molecules involved, and so on. I'm not going to the details. I'm just going to the conclusion. They said SC36, they actually map out the neurological pathway. They said SC36 electroacupuncture leads to a vagal activation of this particular enzyme in the adrenal gland, which results in the increased production of dopamine, and that lower the inflammatory cytokine. And dopamine is currently also used is historically being used to treat sepsis or low blood pressure, right? So this is also shows how acupuncture can actually tap into this pathway and induce desirable clinical change. Okay, this is in mice. How about in human? In human, okay, they also not only look at the markers in mice, they also look at the mortality rate, right? If you have sham acupuncture, the mortality rate is very low. If you have true acupuncture, they survive more, especially here. You can see true acupuncture, most of the mice survived. Sham acupuncture, a lot of them didn't, right? So, and then there are also clinical trials showing early traditional Chinese medicine bundle therapy for preventing sepsis for acute GI injury, and which is very relevant in COVID because a lot of them are going to sepsis later in the course. And see here, you see the survival curve. In the control group, there are more mortality. In the acupuncture bundled treatment group, there are higher survival. So it appears that if we can join forces with Eastern and Western medicine, we'll add to our toolbox or our arsenals to fight this COVID-19 disease, especially in people who are very vulnerable, like elderly patients or immunosuppressed patients and cancer patients. But how do we do that, right? How do we join force? So here, things come, there are some opportunities, also some challenges. And the challenge is mainly a system challenge, like more like a legal or political or cultural challenge rather than a scientific challenge. So the in our institution, in our practice setting, what we do is we de-emphasize. We cannot say, "Oh, this TCM will treat virus COVID-19 in cancer patients," because we don't have definitive evidence. What we have are these indirect evidence, laboratory studies, and so on. So we still we wish we can do some studies and give patients some herbal formulation, especially the mild case, patient with mild case, to see whether we can prevent them from progressing to serious disease. But in the current setting, we cannot do that. What we can do is to use the TCM approach to improve patients' constitution and the immunity, basically strengthen, right? And a lot of them come from the general lifestyle change advice that derive from TCM or other Eastern medicine modality systems, such as Ayurvedic medicine from India as well. So I'm going to just show the situation in our institution. Is a case study of how to introduce TCM to a major cancer center in the United States. Our institution is the oldest hospital dedicated to cancer care since back in 1884. At that time, cancer was a rare disease, so not a lot of people are focusing on cancer because people's life expectancy was only like 40-some-year-old. And cancer tend to happen in your 60s or 70s. But since then, the hospital has grown into a large cancer center with multiple locations in Manhattan. The center specialized in chemotherapy, very cutting-edge, science-based new treatment, chemotherapy, radiation surgery, and so on. However, in 1990, 20 years ago, they established an integrated medicine program, which the goal is to integrate non-drug interventions, many derived from non-Western traditions, to help cancer patients. And our mission is to make integrated medicine part of standard care. So it's not like add-on or afterthought. It's just everyone who got cancer care, they got integrated medicine. I think we kind of achieved that in our institution, but in the general sense, in the overall cancer care landscape in the United States, I would say we still have a long way to go. But we're doing a lot of research. With the research data, we are able to demonstrate the benefit. Then it's much easier for every cancer center or every hospital in the United States to consider making integrated medicine, which incorporate acupuncture, sometimes natural health product as part of standard cancer care. That's our lofty mission. And so that we can improve patients' experience, outcome, wellness, and survival. And so how do we do that specifically, right? So the first thing is when we treat our cancer patients during the pandemic, the first thing is safety. Safety of the patients and safety of our staff. So how do we ensure safety? I think the fundamentals, there are really two things. One is screening and testing. The other one is infection control. And the good thing is, as I mentioned earlier, during the early stage of the pandemic, there are a lot of healthcare workers were infected. But if you look at later, once the PPEs are in place, once when the testing is in place, very few are infected. In our hospital, with all the treatment we have of our COVID patients who are also cancer, our hospital, we treat only cancer patients, right? So all the patients in our hospital are cancer patients, all the COVID-19 patients, they are also cancer patients. The healthcare providers have very few infections since we started to implement this screening and testing. So this is a very fluid situation. It depends on the availability of testing and the resource, the testing kits, and the availability of PPE, right? Initially, there was a shortage of PPE, but now it's relief, so we can do more. So this is our current policy, but it can change. It can change next week. It can change next month, because as we learn more about how the infection spread and how we can prevent it. So for all patients, we screen them for symptoms. If they are symptomatic, they got tested. If asymptomatic in the low-risk interaction, they don't have to be tested, but we encourage them to be tested. Test as many people as possible. And the risk means twofold. One is are they at risk themselves? Are they, for example, pediatric patient getting high dose chemotherapy, they're at risk. Or people with hematological malignancy, leukemia, lymphoma, they're at high risk. So even though they don't have symptoms, we test them. For other patients, we don't always test them. But if they're admitted to hospital for chemotherapy, for any other treatment, for procedures, all of them are tested on admission and tested every 3 days. So this way, we maintain a COVID-free environment in our hospital to prevent nosocomial infection. So we basically have, at this point, have no nosocomial infections, which is internal infection in the environment of the hospital setting. And then, so testing and screening and testing are important. And then infection control is important. Universal PPE, which means everybody in the hospital, all the healthcare provider, anyone in the hospital, they wear procedure mask and face shield or goggles as well. All patients coming to the hospital, they're given a procedure mask on premise. And if they are high-risk environment, for example, treating COVID patients in the room, or they're doing procedures that generate aerosols, they wear N95 masks when indicated. So with all these in place, we're able to cut down the nosocomial infection essentially to 0, and which is very reassuring to our therapists, because we have acupuncturists. We already started provide acupuncture treatment to our patients 2 weeks ago. And first in the inpatient setting, now this week we're doing the outpatient setting. So by adhering to these procedures and practices, we feel very confident we can prevent infection of our patients by our staff and prevent infection of our staff by patients. So I can answer more questions on this in the Q&A setting. So here, so that's the first thing. We have these things in place, and then what we actually do to help cancer patients who are immunosuppressed. So as I mentioned, we currently do not use herbs. We just started to use acupuncture, but during the peak of the pandemic, the outbreak, we focused mainly on lifestyle changes, mind-body practices to reduce stress, anxiety, lifestyle, diet, exercise, and so on to strengthen their physical resilience. And also we use specific therapy like guided imagery, movement therapy to help people who are on prone ventilation respiration. I'll talk about that in a little while. So lifestyle changes during social distancing, on one hand, is very inconvenient for people. On the other hand, it's a good opportunity to actually improve your nutrition during the lockdown. Why? Because first, you can use, a lot of people now have more time, and they used to just buy food from the outside, they dine out, they buy takeout. Now they can learn how to do home cooking because it's cleaner, more healthy, and this is a good time to learn that. And this is the plate we recommend people to take, a very colorful plate, right? You have lots of colorful vegetables and fruits, whole grains, dark carbs, not white carbs, good protein from less red meat and more beans and nuts and tofu and eggs and so on. So you can eat healthy, and we encourage people to do home cooking. And we give counseling, we teach them how to do that and how to select a balanced and nutrition-rich ingredients. Because junk food weakens your body, and we know junk food creates more high blood pressure, diabetes, and we all know during COVID, those are the patients at a much higher risk to get severe disease, right? So, and this is also a wake-up call to a lot of our patients who used to not to pay too much attention on their nutrition. And we said, at this point, there's no effective treatment. We really just rely on your own immune system. And how to get a robust immune system, you need to focus on nurturing your body. And also you need to eat less, because a lot of the time people eat more and they have obesity, which is a risk factor for COVID. And when you eat less, you can lose weight, maintain your better weight. But you can also eat better, less but better, because you have more quality food. And that also minimizes you going out for grocery shopping, getting contact during social distancing. So our emphasis is on nutrition. You can eat less in quantity, but more in quality. So less, but actually more. Same with exercise. Exercise is important to strengthen the immune system. and has been shown in other studies to help people fight off all kinds of diseases, right, including infectious disease. But because they're in social distancing, they're locked down at home, so we teach them this short exercise, like 7 minutes workout, about a 4 minutes high intensity interval trainings, yoga and Tai Chi. And this, you don't go, a lot of people cannot go to the gym anymore, but you don't need to go to the gym. You can just do it at home, with these things and at your own time. And they also reduce your stress, not only improve your exercise capacity, but also reduce your stress. And we know stress is a big immune killer. And sleep and rhythm is very important. And a lot of people working from home, so they mess up their schedule. They wake up whenever they want, they go to bed whenever they want, they eat whenever they want, which we all know is bad for our health. Especially in TCM teaching, the rhythm is very important. The daily rhythm or the seasonal rhythm is very important. So we need to produce a rhythm, stick with the rhythm, and do a pre-sleep routine, like how do you actively relax your mind? Don't watch TV, don't get on computer. Try to, I call it brush our mind, also brush our teeth, and we also brush our mind. So we go to bed with a very calm state. And this is where a lot of Eastern medicine practice can come into play to help our patients. And we aim at waking up naturally and feeling refreshed. So if you do this, you actually sleep fewer hours. So maybe you would sleep only 6 hours, but it's more refreshing. And during the day, you're more energetic. So less sleep, but actually more energy. That's what we're trying to do. So all these, our Western medical colleagues actually don't address a lot, like the nutrition, exercise, and sleep, and stress. And our integrated medicine service, we incorporate both Eastern and Western medicine. We actually provide this service to our cancer patients. And they are very much appreciated, because that's something they can do actually to help their fight, maintain their health, and help their resistance to COVID disease. And then there's stress management, right? And not only for patients, but also for employees. A lot of them are feeling powerless, right? You see patients dying in front of you and there's nothing you can do. It's a terrible feeling. And as a consequence, lots of sadness, anxiety, also panic, because we don't know how it's transmitted, how it's spread, how we can treat them, and grief, most of all, overwhelmed, just exhausted. And because people are locked down at home, there are lots of marital, family, relationship concerns, fights with kids, and so on, and the parenting issues. So lots of stress here. Of course, we can give them a medication, a pill, but that's not our preferred because they got addicted. So we create a whole program of coping for stress, and they're all online virtual program to rest. We can rest our body because we're in lockdown, we're at home, also rest our mind. And specifically, we got all these specific programs like chair yoga to connect the mind, breath, and breathing, peace from within, teach the people Zen meditation, Zen breathing, escaping, calming escape, guided imagery, music therapy, smile to your heart, getting ready to rest, yoga nidra, and so on. So a lot of Eastern medicine modality incorporate not only for our patients, so this is provided free to our patients during the pandemic, and also to our employees. So they go on, they can attend Zoom class, they can attend tape video, and they can attend online classes. And we also have this prone ventilation, because a lot of these patients, they don't have enough oxygen, but they found so if you lie on your back, this is what your lung look like, right? So a lot of the fluid and the inflammation on the lower goes to the lower back of your lung, and you have very small area of clear lung tissue to get oxygen in and out. Same here. So, but when you lie them reverse, you see the spine here is here, which means this is a CT scan, people lying on the back. If they lie on the belly, the spine goes up. You can see all the heart drops, all this the lung tissue drop. And you got a lot of good airway, clear airway in the lung. So just simply flipping people over can prevent people from getting so hypoxic, low oxygen, they have to be put on a ventilator. So if you can do this, you save a lot of people from going on the ventilator. And this is a simple measure that will do a big good for patients. So we participate. We don't do ventilation. We do that, but we participated in. We designed a program called Prone at Ease. So we make the patients feel very comfortable. How to move from the regular position to the prone position. We use a lot of yoga techniques to do that. And when they are down on their back, on their belly, how to make them comfortable, and how to make them comfortable for hours by piping this music therapy, and also teach them how to move gently and how to put their body in a very comfortable position. So this Prone of Ease program is very popular among the ICU doctors, and they feel that this is very helpful to them. And we hope also prevented some patients from deteriorating in their oxygenation, therefore prevented them from getting on the ventilator. So these are the specific things we actually did for our cancer patients who are immune suppressed. And as you can see, COVID is a new thing. On the other hand, it's an old thing because it's just another infectious disease. We can control it. We can control it by practicing infectious control and PPE testing and tracking and so on. We can also treat these patients, even though we don't have a blockbuster knockout drug. There are a lot of things that are used for other treatment of other infectious disease, especially those enhance our immune system and tame our inflammatory response. Some of them came from traditional Chinese medicine practice, can be used in treating immunocompromised COVID patients. And I think more importantly is this lifestyle change, Tao of nurturing life, 养生之道. So everyone in the society can maintain optimal health even before the infection set in. I hope after COVID, if any good COVID pandemic can do is to make the society realize how precious our health is and how precious we have to take care of our body, our mind, when there is no disease. So when the disease comes, we're fully prepared to fight it. Thank you, and I'm glad to have this opportunity to talk to you, and I'll be happy to take any questions from them.
Thank you very, very much. That was so interesting on so many levels. First of all, congrats on your timing because it was perfect. It's like 1 hour presentation. Now we're gonna move on to the questions part, and we'll start with some questions that were sent beforehand through the email. And these questions are for you, of course, and they are more centered on your experience of hospital fields during these times of COVID-19, and not so much on immunocompromised patients.
Okay.
So here we go. Yeah, tell me, please.
Yeah. So I see this. So what specific infectious control measures do you advocate for opening TCM clinic?
Yeah, exactly.
As I mentioned earlier, testing is important, but that falls outside our hand, right? That's a societal issue. So hopefully in Portugal, there's adequate testing and tracking and so on. The specific thing you do is you ask the patients, have you been tested recently? You know, if they're tested positive for antibody, that's a good sign. That means they probably had it. And if they're asymptomatic, chances are they're not going to do any spreading. They actually did an experiment. People 8 days after they're symptomatic, even though they are tested positive for the virus, they cannot infect cells in the tissue culture with the virus because the virus appears to be existing in only an RNA form, not a live virus form. So testing is important. And then the PPE. So the specific practice is first environment, right? Your room has to be clean and disposable sheets has to be used. So it's spread by droplet and contact. So when patients come in, you want them to wash their hands, you want them to wear a mask. For you, definitely wear a mask and maybe also a face shield, because I think we're talking about mainly acupuncture, right? And wear a gown and gloves and explain to patients this is what happened. And then when they go in, ask them not to touch the surface in your clinic. They just lie on the bed with a disposable sheet, like a paper sheet, And then after that, you connect, you disinfect. You can spray it with any disinfectants, and collect the garment or whatever and throw it in a disposable bag. And so imagine, so the most risky area is in contacting patients who are, first of all, patients who are symptomatic, they tend to spread a lot of virus. Definitely, you need to screen them for symptoms. If they have symptoms, check them for symptoms. If they have symptoms, I would defer all the treatment to later. Don't treat them. If they're asymptomatic, there's still a small chance. It depends on how prevalent viral carrier is in a particular society. In New York, it's actually could be quite prevalent, but in other places, maybe only 1 in 10,000 people have it. So it's less a concern, but still, you ask them, don't talk too much, wear a mask. When you talk, don't talk too loudly, because that's when you spill out the droplets. And when you minimize contact, especially minimize, so if you talk to them, don't talk to them face to face. Talk to them like obliquely, almost like side by side, but obliquely. So the cone that come out of your breath, like the breath cone that comes out of your mouth, do not hit anybody. So that's another thing I think will be helpful. Of course, wear gloves, wear your hands. So UVC lamps. Okay, I think what you can do with UV lamp is to disinfect the surface or the air. The problem is if you have, let's say, if you have a furniture, it can only disinfect the surface that's see the light. The back of the furniture, you won't disinfect. I think the good thing it does is probably maybe the air in the room that could be helpful. Any suggestion work better online for herbal practice? Yes, you can do definitely use this. Of course, you cannot do pulse anymore. Oh, here, tongue reading, wear face mask. Yes, definitely, for sure. Yeah, this is so close contact, and you actually want to stay a distance. You can see a lot of the tongue even from the distance, right? And or you can do telemedicine and have them take a picture and do that. And actually, the TCM practice in New York, they stopped the acupuncture during the pandemics, but a lot of them are very busy with the herbal practices because a lot of people are interested in herb. So we can still do telemedicine, remote care through telephone or video and provide service here. What precautions should we think about in terms of TCM itself when treating patients with their test positive or symptoms that could be important? Stop tonifying strategies. Okay, yeah. So this is a very big questions. I suggest you. I cannot answer in short. I suggest you read some of the guidelines because a lot of these actually has been addressed in the guidelines that you can find online. Specifically, as I mentioned, we actually give people Yuping Fengshan before or during the, so people who are high risk, right? One example, during the lockdown, there are people who have to work. They go to the supermarket, they're a cashier in the supermarket, or they're healthcare providers, or they're bus drivers. They still have to work, and they are in an environment that there are lots of public. So some of them, especially if they're immune compromised, they're elderly, we do recommend them take either Yuping Fengshan or just astragalus. And sometimes we ask them to take some vitamin C and some zinc. But if they start to have symptoms, we usually switch gear. So if you look at all the TCM formulations used in China, once they start to have symptoms, most of them are like 清热解毒, like anti-inflammatory, antiviral. They're not really immune boosting because at that time, whatever immune system you have is an innate immune system. It's already there. You cannot quickly mobilize them. And actually, a week later, there's a concern that too much immune reaction may be bad. So that's, I would answer that question. Any other question? Next questions?
Yes, if you check your Zoom, there's a Q&A section in which, at the bottom, in which there are already 3 questions, if I'm not mistaken.
Okay, let me see.
Exactly.
Okay, here. Okay, the approach to immune suppressed patients We actually, we are, for immune suppressed patients, we are more vigilant in their other infections because if a healthy patient get COVID infections, they're most likely to just get COVID, right? So at this point, there's no good treatment. We just do whatever COVID treatment. But for immune suppressed cancer patients, you have to watch for fungal infection, other infection like bacterial pneumonia. We do have patients who had COVID, but actually also have overlying bacterial pneumonia. That is actually what made the patient very sick. Next question, as TCM practitioner in Portugal, we use mostly herbal pattern formulations based on this research. You recommend to? No, I actually do think formulations are better. It really depends on the practice setting, because if you look at the big data, there are more data on formulas, especially in China, they use a lot of formulas. And the reason we use single herb here is because in the United States, it's harder to use those herbal formulations. It's easier and more accepted by their Western doctors if we have a single herb extract with a clear, well-defined constituents, chemical structure, mechanism of actions, and so on. It's much easier to be accepted. Number 3, yeah, we do think this is a good idea. We actually do give this to people who are at high risk. There is a shortage of this herb in the US, so we don't recommend everyone take it every day. We say you take it if you're at high risk, because there's not enough supply. What kind of music therapy you use? We actually, we don't use a lot of TCM music. The music therapy is actually a profession. So what we do is we actually have trained music therapy. They go through like a master degree and they do internship. They talk to patients because the preference for music therapy is very individualized, very personalized. So what they do is they talk to patients and find out what kind of music works the best for them. And that's how the music was selected. Okay, any other questions?
Very well, there are no more written questions, but if anyone feels like speaking and asking them. So we just received the questions. Are patients with autoimmune conditions more susceptible to cytokine storm?
In theory, yes. But we don't have solid data on that. So in theory, yes, they have that's my guess, right? It's only, it's really not data, but anecdotes. As I mentioned earlier, there are like, at least I know 2 young women who had lingering disease for a long time, for like months. And we all know a lot of these autoimmune diseases like lupus and irritable inflammatory bowel, they are very, young women has a higher risk for that because of the hormone, or because of genetic, whatever. So I think they are more susceptible to, number 1, cytokine storm, and number 2, lingering symptoms afterwards. One example is you probably heard about these pediatric patients, like kids. They had COVID, they usually have mild symptoms, they're fine, and they clear it. But 4 weeks later, they develop this so-called Kawasaki symptoms. It's like inflammation of the blood vessel all over the body, 4 to 8 weeks after the initial COVID. So they have a very robust immune system, but for some reason, their young immune system starts to overreact to their own body. So I do think people with high autoimmune condition, we need to follow them very carefully and be very vigilant.
Well, we still have 10 minutes if anyone wants to ask any question.
Okay, here, any approaches to treat patients after COVID? It's very individualized. A lot of patients, they just basically back to normal. And so we usually use this as a teaching opportunity. Say, well, look, if you take good care of yourself from now on, next time when the disease come or a pandemic come or the second some other illness come, you're at a better position to fight it, to not to get it. And how do you do that? So we teach them a lot of these TCM lifestyle changes and so on. And another population is after COVID, as I mentioned, they have chronic fatigue, they have all the other lingering symptoms. Then we treat them just based on the regular chronic fatigue strategies. Nobody knows what's the best way to treat these patients, right? Because it's a new disease. So basically, we try this, we try that, and over time, we hope we have enough experience. We actually can say something about what's the best treatment. A transplant recipient is less likely to have cytokine storm due to drugs. Yes, in theory, yes, but we don't have a lot of them. We don't have data because, first of all, there are very few of them, transplant recipients. And if you divide it by the number of patients, the most, these patients actually, because they're immune suppressed, we found them super careful, including our cancer patients, because they know they're immune suppressed. They don't go out to begin with. They don't take the public transportation. They wash their hands all the time. They don't touch this. They don't eat that. So their incidence of COVID actually is not higher than the general population. The infection rate is highest for the people who don't care about it, right? A lot of young people, they think they won't get it. They just go out, do everything just the way they did before. And they actually have a higher infection rate. So same with transplant recipients. They're super careful to stay clean. And do they so very few, actually, we have very few transplant patients who got infected. So I cannot say whether they're less likely to have cytokine storm or not, because there's not enough patients to compare.
I see. Any more questions? Anyone? We still have a few minutes left. I would like to remember you can also raise your hand if you wish to speak to Dr. Gary Deng. If not, I think we will settle here for today. I see that we have, that we have a participant thanking you personally in the Q&A section. In representation of Global Branches, I thank you very, very much. This was one of our most interesting webinars by far. And I would like to tell our participants that we'll have another free webinar in 13 days, Thursday, the 18th of June, about the theme DUMAI, diagnosis and clinical application of the extraordinary governor vessel. It will be given by Nicolas Escafi Martinez, who is licensed in TCM by the University of Tianjin, master in acupuncture at the University of Nanjing, and who has been researching the classicals of acupuncture. Be sure not to miss it. It will be co-presented by Acutherapy. I don't know if there are any more questions. No, definitely not. Therefore, thank you very much. Please take care. Have a good weekend. Have a nice week. And thank you very much again, Gary. That was extraordinary. Thank you again.
My pleasure. My pleasure.
Bye-bye.
Bye-bye.